Assalamu alaikum. I am Priyon. Welcome to the Evercare Health Talks. Today we shall be discussing on preventive liver health check, and for that we have our expert consultant amongst us, Dr. Sandeep Dhavan, who is the senior consultant of the Gastroenterology and Hepatology department at Evercare Hospital Chattogram.
Thank you, Preventive, for the nice introduction. So today we shall be discussing about the preventive liver health check. So I am glad to inform you that our hospital has started this new service, and this service should be utilized by those patients, or rather I'd say those people, those who are obese, or if they have ever got their ultrasound and that has showed a fatty liver on the ultrasound. 2. Those patients who are diabetic. 3. Those patients who ever had hepatitis B or hepatitis C. 4. If any of their relatives they had hepatitis B and C and they have been in contact with such like patients, then those patients who had cirrhosis, or those patients who ever had alcohol, and lastly there are few patients who have had medicines for other diseases but they can affect their liver. So these are the group of people, those who should get their liver examined, because I must tell that 90% of the liver diseases are preventable. So if we check them beforehand, then one can avoid all the complications associated with liver disease.
Okay, sir. So what are the tests we do under this liver health check?
Under liver health check, the first thing is that patient has to come fasting, because the liver tests are better if they are done on fasting. So we do few blood tests which will include the liver function test, the cholesterols, the whole of lipid profile, then their complete blood count, the hepatitis B test, hepatitis C. Then most important is we do the ultrasound abdomen to see the status of the liver, gallbladder, pancreas and all the related abdominal organs. And after that, the most important one is the FibroScan, which tells us about the health of the liver.
Okay, sir. So what is this FibroScan? And if a patient has already undergone the ultrasound, is there a need, or what is the importance of the FibroScan for that patient?
Yeah, that's a very important question that patient asks, that I have already got the ultrasound done, so why should I get a FibroScan? Ultrasound basically tells us about the status of the liver, that is, it tells only about the grade of fatty liver. It doesn't tell us about the damage which has been incurred upon the liver. So this FibroScan tells us how much liver is damaged, how much the liver is fatty. In the past few years we have been doing liver biopsy, which has been abandoned now, and the FibroScan gives results equivalent to a liver biopsy. Hence it's very important to know, in addition to how much the liver is fatty, that how much damage is there, so that we can take the next preventive measures.
Okay, sir. Thank you for your kind information. Sir, what are the common liver diseases you see in your OPD chamber?
Yeah, that's important. The most common liver disease which we see in our OPD is the fatty liver disease. And fatty liver disease, once we do the FibroScan, then we see the severity of the liver disease, that is ranging from F1 to F4. F4 means the patient has got cirrhosis, and F0 to F1 means that the patient is in the early stage of liver damage. So depending upon the FibroScan report, we can tell the patient what all precautions to be taken and whether any medication is needed or not. Then the second common group of patient is related to hepatitis B. So again, these patients, if they have been screened beforehand, we can tell them that they are hepatitis B negative, and all of them can get vaccinated. If there is any family member who has got hepatitis B, they can also get the family members screened, rest of the family members be screened, and if they are found to be negative, then again they can be vaccinated. So we can prevent hepatitis B by vaccination, and by doing the lifestyle modifications, reducing weight, taking care of our diet, we can reduce the fatty liver. disease. So these two major group of diseases can be prevented just by simply going to the doctor and getting the preventive liver health check. Then the hepatitis C patients, again, they can also be screened, and if they are picked up early, the liver disease can be cured. Hence, these patients will never go to the stage of cirrhosis and the complications like bleeding from the mouth or fluid in their abdomen or jaundice or encephalopathy. These are the 3 or 4 common complications of cirrhosis which can easily be prevented. And the worst complication, that is hepatocellular carcinoma, also can be prevented if we have picked up these patients early. Then those patients who are taking alcohol, we can also screen them and tell them what damage has been incurred so far. And then lastly, the patients who have been taking few medications for other comorbidities, they can have side effect on the liver, and by doing these preventive liver health check, we can let them know that they have to either stop or alter the dose of these medicines. So there are plenty of advantages of doing this preventive liver health check. So I'll advise all these group of people to undergo the preventive liver health check and thus save their livers.
Okay, sir. So I understand that this is very important test, but I have a question that is this an expensive affair?
So we must know that an ounce of prevention is better than a pound of cure. But having said that, if we do these tests separately, then they are expensive. But we requested the hospital administration and they gladly accepted, and I will say that approximately 30% discount is there, and it's very, very cost effective if we do these tests.
Thank you, sir.